Hello everyone, welcome back to the channel. This is Dr. J, and I have a video for you today. It's a bilateral ear cleaning, and this is a young person, an adolescent, who was brought in by his parents for excessive wax buildup. And the parents were very good about utilizing earwax softening drops, and they were doing this on a fairly regular basis. But despite this, he was still having a lot of buildup. Utilizing frequent earwax softening drops can make an ear cleaning go very, very easily. You'll see here that the wax is coming out nicely, and there's hardly any resistance once you're able to pick it up with the suction and pull it out of the ear canal without any struggle. There's a little bit left here, a little bit deeper, and as I readjust, I can tell there's a little bit of keratinaceous or old skin. It's a very superficial layer of skin that's left in the ear canal with a little bit of cerumen. And this is elevated very nicely off the canal wall. It's not very sticky due to the frequent eardrops. And the last little nugget, if you will, deep in the ear canal, up adjacent to the eardrum, comes out very nicely as well. In between the right ear and the left ear, I'd like to show you some of the common instruments that I use and how they relate to the size of the ear and the ear canal. This first set of instruments is my suction instruments. These are called Frasers here in America and amongst the ear, nose, and throat surgery community. You can see here we have three main ones that I use. I have a number 3, a number 5, and a number 7. The number 3 is very small. It's about a millimeter in diameter. The number 5 section is approximately 2 millimeters in diameter, and the number 7 section is approximately 2.2 to 2.3 millimeters in diameter. So hopefully that will help you understand kind of the size and scope of the ear canal and the instruments that we use inside the ear canal. The average ear canal is going to be about 2.5 centimeters in length and approximately 7 millimeters in diameter. So there's not a lot of room to work in the ear canal. It's a very small space. Good thing we have microscopes and endoscopes to help us accomplish that. This left ear has fairly large impaction, and fortunately, due to all the earwax softening drops that they've been applying to the ear, this chunk comes out whole, which is always very satisfying, not only for the practitioner, but for patients who are watching on the monitor next to where they're seated. If you'd like to see how sometimes patients react when they see these big plugs come out, take a look at the video linked here. It can be quite dramatic sometimes while you're working in a patient's ear. And we're going to go back inside the ear canal here. Again, this speculum, just for size reference, this is our larger, more often than not for adults, ear speculum. And it's approximately 6 millimeters, so just slightly smaller than the average adult ear canal. And we started with the number 7 section there. We're switching over to a number 5, slightly smaller, gives us just a little more room to see and work in a somewhat constricted and oblong-shaped ear canal. And there's a healthy eardrum. Appreciate you guys sticking with me on this one. Please let me know if you would like some more information on instrumentation we use. Thank you very much for watching, and we'll see you on the next video.